This isn't something that we took lightly, and we understand that this will have a significant impact on many Nunavut.
Tonight, Nunavut is shutting schools and daycares, but why will the Arctic College remain open?
So everybody that's in the program has to go through a financial literacy.
An Edmonton business offers Indigenous employees a down payment for their first home.
When I went through there, they would basically tell me that you're at stage 5 kidney failure.
And we meet a Cree rapper who's raising awareness about kidney disease while sharing his personal story. Good evening. Welcome to APTN National News. I'm Melissa Ridgen. The federal government announced today that COVID-19 cases have surged past 400. And with the report that a Saskatchewan First Nation has one presumptive case, the need to protect Indigenous communities is becoming more acute. But as Todd Lamarand reports, it's not clear if enough is being done.
On Monday, the Prime Minister spoke about the COVID-19 Response Fund, which has $100 million for Indigenous communities.
On Friday, I spoke with First Nations, Inuit, and Métis Nation leaders to discuss the work we're doing together on preparedness and mitigation efforts.
At a press conference later that same day, Dr. Theresa Tam said those communities need to collaborate with local jurisdictions, and she's making sure best practices also work in northern isolated First Nations.
Well, what does social distancing actually mean in a very different context? And so I think that's the kind of work that's underway right now, and we need to really accelerate it. So I think that nothing that we do is ever too much. We need to have more engagement and ensure that the needs of those communities are met.
Amid reports that some First Nations are restricting travel in and out of their reserves, Dr. Tam acknowledged the virus cannot enter communities ill-equipped to deal with it.
Ability to tolerate that kind of risk is such that I think many are thinking, well, we just can't afford to let the virus enter. So as a result, many might be taking those kind of decisions, but it is an individual community decision as well.
APTN News asked Dr. Tam if the military should be used to build field hospitals and send medical personnel, for example, if vulnerable, isolated communities get overwhelmed by cases.
But if there's a certain need for some surge capacity, some of those things can absolutely be considered.
The COVID Cabinet Committee will now hold daily briefings, but it's not known if Indigenous services will be included in those, even though Miller is now a full member of the committee. Todd Lamarand, APTN National News, Ottawa.
There are still no cases of COVID-19 in Nunavut, but the territorial government has announced a closing of all schools as a preventative measure. Our Kent Driscoll has more from Iqaluit.
Nunavut still has no positive results for the COVID-19 virus. There are 30 tests still being processed. Today, the government closed down schools in all of Nunavut's 22 communities for the next 3 weeks.
This isn't something that we took lightly, and we understand that this will have a significant impact on many Nunavut.
Nunavut's Premier Joseph Ikita was on hand for the announcement and has some Nunavut-specific advice for social distancing.
Social distance, that's that far apart. So you can't touch each other. That's social distancing, that's one aspect of it. And the other part that's going to be very hard, because it's kind of ingrained in us, because Nunavut are friendly. Don't shake hands, don't hug, and don't kiss or kunik the babies.
All Nunavut schools and daycares will be closed starting tomorrow. One notable exception, Nunavut Arctic College will remain open. We wanted to know why.
The classes are smaller. The students are older and more mature, and so we'll have an easier time maintaining social distancing and limiting transmission that way. The other factor is that the impacts of closing Nunavut Arctic College for a lengthy duration are greater. There are fourth-year students set to finish a degree program with a license, and their skills are needed.
The situation is constantly changing. This morning, students boarded school buses all over the territory. Tomorrow, they won't. And Nunavut will wait to see when COVID-19 arrives in Nunavut and what happens then. Kent Driscoll, APTN National News, Iqaluit.
Still in the north, in the Yukon, more than 100 people have been tested for COVID-19, and still the territory remains with 0 confirmed cases. In a media briefing in Whitehorse, the territory's chief medical officer of health reinforced that social distancing and self-isolation measures can limit the spread of COVID-19. Individuals that have traveled outside the territory in the last 14 days and are feeling sick should not visit hospitals and should self-isolate. Mass gatherings of over 50 people are banned, and people that can work from home are suggested to do so. Dr. Catherine Elliott is the Yukon's Deputy Chief Medical Officer. She says that community diligence is important for prevention.
We have a window of opportunity to look at these things. We will be acting quickly. However, we are fortunate at this moment that we can act with a bit more of a measured response and a little bit more time for risk assessment than other places in Canada.
British Columbia is currently dealing with some of the highest numbers of COVID-19 infections and deaths in the country. Joining us from West Vancouver is Dr. Shannon McDonald. She's a physician and also the Deputy Medical Health Officer for the First Nations Health Authority. Dr. McDonald, thanks for joining us. Shannon, what's the First Nations Health Authority doing in the wake of this pandemic?
Starting in mid-January, we stood up a team that we're calling our First Nations Public Health Response Team to start the preparations, knowing what was happening in other places of the world, understanding our risk, and beginning to work on some of the preparations. Since that time, we have now moved up that team to a level 1 response, understanding that there are community-acquired cases in British Columbia and that we need to do more.
How many confirmed cases are in British Columbia right now, and are any of those presenting risks to First Nations populations at this point?
As of yesterday, there were 94 confirmed cases. We know that there are a couple of thousand actually test tubes that need to be tested, that are in a queue to be tested, so the number is probably really underestimating the true impact. Just like every other citizen in the world right now, First Nations are at risk, especially individuals who don't have access to great resources for personal health care, for hygiene and others. We think particularly of some of our urban populations, the significant number of individuals who are homeless in our urban centers, and as well our elders and those with chronic disease or impacted immune systems in our communities. So because there's so much traffic in and out some of our communities, we're being really conscious of making people aware of the risks to those individuals and to plan for them.
Those people particularly at high risk or who don't have access to good sanitation, what can those people do to prevent getting sick?
Right. So I've done a bit of research over the weekend because it was a question that was raised to me on Friday about communities with boiled water advisories and what do they do about hand hygiene, for example. What I've been able to find is that there are several different sort of levels of risk that water issues can present to a community, and there's a difference between a drinking water advisory, which may be a boil water advisory, and a do not consume advisory. So in the cases of a boil water advisory, either boiled and cooled water can be used for hand washing, or just the water out of the tap with soap are sufficient to kill the COVID virus. It's still recommended that people use hand sanitizer if they have it available as well. For communities that have the do not consume advisories, the rules are a little bit different, and in those cases, most cases, the water is shipped to community for drinking purposes, cooking purposes, and now that would also include hand hygiene purposes.
Excellent. Shannon, thanks so much for that valuable information and for taking time out of your day to share it with our audience.
Thanks, Melissa. It's good to talk to you.
British Columbia is now reporting 3 additional deaths from COVID-19 from an outbreak in a North Vancouver care home. The provincial health officer says 30 additional cases today bring the BC total to now 103. We've got to take a quick break, but we've got more news ahead about how the COVID-19 pandemic is affecting your region. First, here's tomorrow's weather forecast for the east and central parts of Canada. Starting off on the east coast, we've got 2 for Fredericton and snow, 2 a mix of sun and cloud for Charlottetown. La Grande River -6 in snow, Kuujjuaq -5 in snow. Sept-Îles and Gasp -1 and snow, Montreal 6. Windsor 10 degrees and rain, -3 and snow for Sault Ste. Marie. Kapuas Casings -3 and snow, 2 -6 and snow for Sioux Lookout. -11 for Thompson and Norway House and sunny skies, -12 for God's Lake and sunshine. -7 and sunny for Winnipeg, -4 and cloud for Brandon. -6 and snow for Saskatoon and North Battleford, -3 and cloud for Regina. Meadow Lakes -9 with a mix of sun and clouds, -16 and clear skies for Uranium City. Welcome back. We start off in the Atlantic region where Prince Edward Island is reporting 1 confirmed case of COVID-19. New Brunswick is reporting 2 confirmed and 4 probable cases, while Nova Scotia has 5 probable cases and Newfoundland and Labrador has 1 probable case. When Tanis Sillyboy, a nurse in Eskasoni, heard about the suspected cases in Nova Scotia, he made posters to protect members of his community. They show the risk level of the coronavirus and let visitors know if people are susceptible or in self-isolation. Sillyboy is sharing his posters with other communities in Cape Breton and hopes that more communities will do the same to reduce the risk of spreading of the virus. In Ontario, COVID-19 cases continued to grow over the weekend. On Monday, the province reported that it now has upward of 177 confirmed cases. That's, of course, as of today. While there are no confirmed cases in any of the province's First Nations, Premier Doug Ford has not said how the province will help First Nations mitigate the pandemic. Kitchener-Magoosup in Nunavut is a fly-in community known as KI in northwestern Ontario. Chief Donnie Morris says he hasn't been in touch with the provincial or federal government, but is implementing safety measures and says that his community would use any support funds to ensure that elders and other community members have access to traditional resources.
We got to buy wood, have people go out traditionally to get fish, hunt, and all these things. Our own natural intake of what we have in our area. Sending people out and getting a plane in here to fly out people out to remote lakes, territory to go hunt. Because we can't go out and purchase groceries, meat, stuff like that down south. We got to turn around and look up north.
In some non-COVID related news, an Indigenous-owned company in Edmonton is offering to pay the down payment for first-time home buyers. It's for its Indigenous employees. APTN's Chris Stewart spoke to the CEO of Backwoods Energy Services to talk about their rare offer.
Paul Pacenti is the CEO of Backwoods Energy Services. Owned by the Alexis Nakota Sioux Nation, the company works in oil and gas, forestry, and security fields. And business is good. Pacenti says for the past 2 years, they have been planning to help the Indigenous peoples who work for them. They will provide up to $20,000 for a home down payment for first-time home buyers. He says the program will help the people who may have a hard time getting finances from a bank.
It encompasses 2 parts. There's a financial support part and a financial literacy part. So everybody that's in the program has to go through a financial literacy, what's an RRSP, what's compounded interest.
They also provide RRSPs to their employees. Pacenti says he would like to see other companies providing similar benefits to their employees. He believes they are the only company in Alberta to offer this.
And my hope is that this becomes a non-rival good, that other companies see what we're doing, see the benefit of home ownership for people, and add this to benefits for their own employees.
To help. Employees have already begun the financial literacy training and on their way to their first home. APTN asked why Backwoods Energy is doing this, since they don't have to.
Because it's the right thing to do. Because we have the capability of doing it. Maya Angelou, there's a great quote by the poet Maya Angelou that says, "Do as well as you can until you know better, then do better." And maybe that's the approach we're taking.
Chris Stewart, APTN National News, Edmonton.
A British Columbia Human Rights Tribunal has awarded a Tsimshian Haisla woman $23,000 from her landlord. The tribunal ruled that the landlord made stereotypical comments about her or to her about Indigenous people and tried to evict her for smudging. He was ordered to pay her $20,000 for injury to her dignity plus lost wages and expenses. Crystal Smith talked to Dennis Ward about the ruling earlier.
Crystal, thanks for being with us. Was this the outcome you expected when you filed your complaint?
This is the outcome that I hoped for, actually. What happened was really kind of stressful, and it actually surprised me because I never experienced that before, and so I didn't want anyone else to be able to experience what I experienced when my landlord evicted me for smudging. And so that's why I filed a human rights complaint.
So you lived in a basement suite and there were people living upstairs. Tell us a bit about how the smudging became a problem.
Yeah, so the people that were living upstairs, they did have some asthma problems, but we worked it out. I went and spoke with them, and they said that they would close the vents to their suite so that nothing would happen. And so that worked out fine, and then they later moved out, and my landlord was doing construction up there. And I'd been smudging every day, and like he never noticed it. And then one day he did, and he came upstairs and he checked it out and asked me if it was like normal and like what is his process. And so I showed him my shell, I showed him the sage, I showed him feather, and I kind of went through it mechanically, like what I do and what my children do. And he said, "Do you promise that this is not going to damage my building?" And I said, "Of course it's not going to damage your building. It's going to be better for your building, you know, because it cleans the air and purifies the space." And he said, "Okay," and he left. And then like 2 days later, he's sending me notices saying that I have to stop smudging. So it just went from like being an okay relationship to being like this, my housing is getting threatened.
What are you hoping is the message that is sent by this?
I really hope that Canadians, landlords, really see that as Indigenous people we have rights to our ceremonial ways, that, you know, previously Canada had tried to make our ways illegal. It's throughout the Indian Act, and we're in 2020 now. We are doing the best that we can, trying to make a reciprocal relationship with Canada and Canadians, and they just really need to stop making us bend and making us stop what we're supposed to be doing.
Well, Crystal, we'll leave it there, but appreciate you coming on to speak with us about this all.
Yes, Gayasika, thank you.
It's time for us to take another break, but still ahead, a well-known rapper is sharing his personal story with kidney disease in hopes of educating about diabetes. And here is the rest of tomorrow's weather for the west and the north. To northern Alberta, we got -15 for Fort Chip and snow there, -5 and snow for Grand Prairie. Sunshine at 2 degrees for Lethbridge, -1 and sunny for Medicine Hat. Ballacoola is 11 and cloudy, 12 and sunshine for Victoria and Vancouver. -1 and sunshine for Dease Lake, 4 and sunny for Smithers. Old Crow, -4 and sunny skies, -4 in Mayo and Dawson, too. Trout Lake, 1 and snow, -11 and snow for Wati. Fort McPherson, -6 and cloudy skies, Polytech, -12 and sunshine. Baker Lake, -24 and clear, -23 for Arviat and Whale Cove and clear skies there. Clyde River, -25, mostly sunny skies. Pangertung is clear and -17. welcome back. March is National Kidney Month here in Canada. Every year, organizations across the country raise awareness about kidney health and kidney disease prevention. Statistics show that Indigenous people have a higher risk of having diabetes, one of the main causes of kidney disease. Brittany Hobson introduces us to one Cree musician who is using his voice to educate others.
Used to help with the racism I was facing, bent aggression, used to battle anybody.
Carmen Omisu is no stranger to the stage. The musician, who goes by the name Hellenbach, has been performing for decades. But a health scare last year now has the 40-year-old using his platform to educate others. In July, Omisu visited a nursing station in northern Manitoba after having trouble breathing.
They called me the next day and they were very frantic about everything. And when I went to there, they were basically telling me that you're at stage 5 kidney failure.
The news came as a shock. Omisu was diagnosed with type 2 diabetes when he was 19 years old. But he never considered this would lead to kidney disease.
It really snuck up on me, you know. They were really worried about my health and everything. But at the time, I felt normal.
Kidneys help the body get rid of extra fluid, waste, or minerals. When they stop working, the body can't get rid of the excess stuff it doesn't need. This leads to sickness.
Kidneys are very much a bystander they're innocent bystanders of everything else that goes on often in many individuals, and diabetes is one of the underlying problems that causes harm to the kidneys.
Dr. Mauro Varelli is the medical director for the Manitoba Renal Program. The team provides services for kidney care across the province. If caught early on, kidney health concerns can be treated.
Things we identify early on in the course of kidney disease are generally treatable with simple medications, simple maneuvers that we described with healthy living, for example, in a primary care setting. You don't need to have a specialist to do that.
Manitoba has the highest rates of kidney disease in Canada. 1 in 10 people are living with it. Data shows approximately 34% of people screened in remote northern communities in the province are also living with the disease. This is due to diet, health services, and genetics. Omisu credits his wife, family, and fans for getting him through treatments. He is having a transplant in May. Until then, he is continuing to advocate for more education in communities.
Kidney health was the last thing on my mind. So, I would love to see a lot more awareness like that. And, just people talking about it more candidly, people talking about it, openly and this and that.
Monday, if I'm blessed.
Brittany Hobson, APTN National News, Winnipeg.
That is all the time that we have for your news tonight. We're keeping up on top of the COVID-19 pandemic, so keep checking our website, aptnnews.ca, for updates that may be relevant to you. I'm Melissa Ridgen. Have a great night. We'll see you back here tomorrow.